Welcome to our vlog!
I assume that she has full capacity, no safeguarding concerns, no respect form or DNA CPR goals and framework. Hello, mga ka-Team Oxy. This is Jerome, a clinical nurse specialist in interventional oncology here in Leeds, England. How did I become one? Tara, pakinggan nyo kwento ko.
Joaquin! Dad! Mom!
Backstory muna tayo guys sa Pinas. Kita nyo naman, since then, pinapuarmahan na ako ni Madam.
When?
I got my nursing degree in Our Lady of Fatima University back in 2011. Shoutout muna sa lahat na naging kabatch ko at to all Fatimanians. At natapos na nga ang board exam. That time, inaabot ng few months ang release ng results. Si Kuya, excited magtatrabaho. Ang ending, I work in a clothing line for 6 months. But don't get me wrong, it was a good experience.
Nice.
After I got my Philippine nursing license, akala ko I will have a proper nursing job agad. Di pala. I applied to a lot of hospitals. Meron nagbigay ng opportunity, but as a volunteer, which you get only an allowance of 500 pesos a month. The first overseas country na I practiced was in United Arab Emirates, specifically in Abu Dhabi. Kita nyo naman, sinundan agad ako dyan ni wifey. Namiss agad yan. I work in different companies. Una, sa Desierto as a clinic nurse. Also as a dental nurse. And even a CAD/CAM operator na gumagawa ng ngipin.
Wait, what?
Ewan ko nga ba paano ako napasok sa field na yon? Eventually, I shifted in nursing management, being as a supervisor and then a nursing director. During that time, COVID pandemic started. At the same time, Rhea got pregnant and after 9 months, Joaquin came to Earth. Back to UK na tayo mga ka-Team Oxy. Sa cohort namin, ako lang yung nag-iisang guy na na-assign sa satellite hospital ng trust namin. My first role being a ward nurse. The job was okay and the team was really great, especially Pinoys. Actually, we are still seeing each other, even walang occasions. But, I really feel that bedside nursing is really not for me talaga.
I don't wanna!
I even shifted to being a telephone triage nurse, which was great since we have the opportunity to work remotely, like at home. Then, an opportunity knocked for a Band 6 position. Siyempre, ako pa ba? Kinrab ko na yan agad mga ka-Team Oxy.
Yes! Yes!
So yun na nga, let's get back to the main topic of the vlog. Paano ko ba nakuha yung clinical nurse specialist position?
How could...
First thing na in-establish ko is kung sure ba talaga ako na gusto ko ng career progression. Siyempre, not all nurses are the same. Like some of them are happy being a bedside nurse, giving direct care to the patients, and receiving directives from the seniors. Next is, I explored different specialties. Unlike sa Pinas na most are general nurses, hindi naman lahat. Dito sa UK, madaming specialties and subspecialties. Like me, I am a clinical nurse in interventional radiology nursing, but is specific to interventional oncology. We are treating cancer tumors using radiographic imaging like CT scan and ultrasound. Of course, get all the training and experiences na available sa NHS. Ano ka ba? Bukod sa sagot na yan ng hospital, bayad pa time mo for the training.
True.
You also have to expand your professional connections. Do not be hesitant to meet and to speak to different healthcare professionals. Malay mo, sila pala ang makakatulong sa'yo in the future. And one of the most important thing is to be confident. Nakapasa ka nga sa board exam? Baka nga mas marami ka pang bansa na naka-registered as an RN kesa sa akin.
Wow.
Yakang-yakang mo yan. But of course, do not be overconfident and do a lot of research. Especially sa specialty na napupusuan mo. para ka lang nanliligaw dyan kapag nag-a-apply and dapat alam mo yung kiliti nila. Lastly, learn how to move on. Kahit di ka matanggap sa interview, you will still get used to the frequent questions and will soon find out the answer that they like to hear. Kung ayaw nila, marami pa dyang iba. To be honest, I failed a lot of interviews. From hepatology, rheumatology, and even being a bed manager. Lahat yun, bagsak. But so what? Di nyo ako natikman.
Don't give a fuck kung ayaw mo sa akin, di wag.
What are the pros and cons of being a nurse specialist? First, is you can practice independently most of the time, except if you need a consultant advice, of course. Walang multiple bosses na micromanage sa'yo. You can practice autonomously on your own pace as long as you're within the standards. You also have clinical focus. For us, it's the treatment of cancer tumors by using ablative therapy. Any issues that is or are beyond our scope, like electrolyte imbalance, diabetic management, or anything else, we have to refer it to the specific specialty na mas appropriate sa concern. We have a work-life balance. If we finish all our tasks, then it's done. Of course, if not, we have to stay. So dyan papasok yung proper task prioritization and time management. We also have a 4-day week shift. And weekends at holidays are off. No out-of-hours duty. We have a lot of career progression opportunity. Plenty of courses and training. I even have a conference upcoming down south that will be fully funded by the trust. I am also planning to take a non-medical prescriber course very soon.
Wait a minute!
What about the cons? Well, you are trying to increase your band. There will be a different responsibilities than the others might say more. You are also solely responsible on your most clinical decisions, kaya you have to be aware of the local policies and pathways. We are also a small team, 3 to be exact, in interventional oncology. So pag mayroong may sakit, syempre you have to cover. We also need to adjust our annual leave sa aming tatlo as much as possible. Good thing, we are all team players and we want to be even to each other.
Okay then.
And lastly, since walang night shift, weekend or holiday shifts, edi wala ring enhancement, kaya sometimes if I am free, I do bank shift paminsan-minsan. Oh, eto na nga. Na-invite ka na for an interview sa isang clinical nurse specialist position. Ano nga ba ang mga frequently asked questions during the interview? Siyempre, di mawawala dyan ang tell me about yourself, my friend. Kayang-kaya mo na yan. Di ko na kailangan explain yan.
Fine.
Next is, what is your understanding about the role? Siyempre, di ka naman nila i-hire ka Team Moxie kung di mo alam yung papasukin mo, di ba? Kaya, research is the key.
Interesting.
What can you contribute to the team? Diyan mo ibibenta yung sarili mo. What can they get from you that is not available from others? For me, I showcased my DIT skills. So think out of the box. Nursing is not only giving care to the patients, especially today that innovation is evolving quickly.
This is why you hire a professional.
Where do you see yourself 1 year from today? Picture yourself to be a successful key player in the team, that you have contributed a lot to improve how you deliver the current nursing services in the current area.
I see you.
What are your weaknesses? When they ask this question, they also want to know how this weakness could be a potential strength. Let's say that you consider one of your weakness is being a patient advocate, that you do all your best to ensure the patient's right is protected even you go beyond your capacity. Previous quality improvement projects. Also show them your previous projects, even back on your country. It doesn't need to be a big one, but should show your passion in your chosen career.
Holy cow!
And di mawawala ang mga scenario and role plays like patient care management, conflict resolution, managing complaints, and stress.
What can I do for you? The time for talk is past.
Do not forget that the interviewers are NMC registered professionals. They are also a trust employees. So the key is always align your answers with the NMC code, 6 C's, and trust values. Also the mission and vision of the trust. And I am sure that you will ace your interview. That concludes our training. Vlog. I hope that this video can give you some information you might need. If not, thank you still for watching. Sa mga nagpa-plan dyan maging clinical nurse specialist, do not waste your time. There are a lot of opportunities out there. Kung kaya ko, syempre kayang-kaya nyo rin. Until the next video,
Please like and subscribe.